Following the spike in COVID cases being reported from Southeast Asia, there are cases which have been reported in our country as well. But the big question is, what is this new variant? Do we need to worry about it? Some states have, in fact, reported these cases, ladies and gentlemen, and that is going to be our top focus at this moment. Let me first very quickly bring you up to date with the top developments as far as the COVID surge is concerned. Number one, India has logged about 1,000 cases of new cases of COVID which have been reported from various states. Spike has been reported from Kerala, Karnataka, Maharashtra, now in Delhi as well. Number three, in fact, on this, national capital has also recorded now 100 cases of COVID which is being reported from across, a new variant which has been reported from across. Delhi government has issued an advisory as well on this development. Number five, the Union Health Secretary has held review meetings as far as the COVID is concerned in the country to ensure that everybody is well prepared. The government said the situation is under control. There is no need to panic at this moment. Let me also tell you very quickly that most cases which have been reported are mild cases and so far nothing that the doctors say that we need to worry about at this moment. Very quickly, state-wise data, Kerala has reported 430 cases, Maharashtra 209, Delhi 104, 83 in Gujarat, 69 in Tamil Nadu, 15 in Uttar Pradesh, and 12 in West Bengal. Once again, like the last time, Kerala, because of an influx of a lot of people coming from outside, is possibly reported more cases, 1,009 cases so far being reported from across the country. Very quickly, let me also tell you what is this variant and how much do you need to worry about that. The new sub-variant that people are talking about is N.1.8.1. And this is the new COVID subvariant, somewhere from the Omicron lineage. Apart from that, WHO has designated it as a variant under monitoring. So they are monitoring the mutation as far as this variant is concerned. The epidemiological impact is unclear at this moment, and more study is being done on how this variant has mutated. The earliest samples were reported in January 2025. We are in May, so it's just been 4 months and more data needs to come through it. Detected in 20 countries, including India, United States, and Japan, along with some South Asian countries as well. Symptoms include fever, dry cough, sore throat, and headache. Much like the symptoms last time, but milder than what we saw at the peak of the COVID. Experts at this moment say there is no need to worry. You don't need to run across to get a booster dose at this moment. What's the government saying about this? There is rise in the COVID cases and it is being reviewed by the Health Secretary. They are keeping a watch on it. Review meetings on 24th May to bring all states up to speed as far as the government is concerned. Most cases are mild and under home care. Just 5 days isolation, so on and so forth, and you are absolutely fine. No indication that circulating variant is more transmissible as the others. But, just as a precaution, if you are going out in an area which is crowded, just wear your mask. Ministry says remain vigilant and there is no need to panic at this moment. Let's listen into one reaction.
करंट सिनेरियो ये है कि कुछ केसेस में इंक्रीज़ हुआ है, कई पार्ट्स, कई देश के भागों में, पहले साउथ में, वेस्ट में, और अब कुछ केसेस बाकी कंट्री के पार्ट में आए हैं. लेकिन अगर मैं आपसे ये कहूँ, इस समय कोई वरी करने की इतनी कोई ज़रूरत नहीं है, सिर्फ विजिलेंट रहने की ज़रूरत है.
There is no need to panic. Just precaution is what we are also advising here. My colleague Uma Sudhir joining us because there is a surge that we have seen in Kerala and Tamil Nadu to bring us up to speed with what's happening there. Uma, like I was explaining, there is need for vigilance at this moment. No need to push the panic button. What are the governments doing in Kerala and Tamil Nadu?
Kerala has always had high surveillance rates and high testing as well, and that's the reason why in every successive COVID wave we have seen Kerala reporting the highest number of cases, and in this case as well 430 out of the 1,000 odd cases in India are being reported out of Kerala. And of course, you mentioned Tamil Nadu, which is the place where, in fact, the variant that you mentioned has been first detected in the month of April itself. And the two other things that I must point out is that, of course, Karnataka also, you're talking about a few cases. Andhra Pradesh had last week issued certain guidelines talking about not going for gatherings and stopping those kind of public places in which people are gathering in big numbers without wearing masks. Subsequently, they said it's only for the officials and we are not releasing it to the public because no one wants to create any kind of a panic. And in Telangana as well, a single case that was reported in Kukatpalli in Hyderabad, and therefore you don't see a sense of panic. I'm here at a market and not a single person I've seen with a mask so far, but I must point out that everyone knows that, if it is going from 237 to 1,000 plus in 1 week, you cannot take it too coolly, and therefore you need to take certain precautions because we have seen in the past that the numbers do jump up very hugely. Like you mentioned, this has been called as a variant under monitoring and not as a variant of concern or a variant of interest, both of which have been, reasons to worry when the variant becomes of that form. And that's the reason why, while while people are not panicking that there is a COVID that is coming about, but they are watching the developments very closely because they do know that the numbers can go up very, very quickly. And therefore, while the government has been making preparations even otherwise for heat-related illnesses and then rain-related illnesses, which really tend to go up in this season, especially because the monsoons have come early and you are going to see gastro and other malaria and dengue and all of that coming up. And therefore, the preparedness for COVID as well, with the hospitals actually now identifying those COVID wards and keeping them ready for any kind of a likelihood that may happen. Hopefully, because the virus is already endemic in the population and is no longer being called as a pandemic, but as something that's endemic, and all of us having the, resistance that is there with us.
Yes.
And therefore, with that sense of caution, but not really panic.
Absolutely, Uma. Thank you for joining us with all those details. Ladies and gentlemen, it's time to be vigilant. And at least at this moment, that's all that is required. We're slipping into a short break.